I have a lot of patients asking me about neck pain, about cervical problems. They're getting headaches, they're getting migraines, pains going into their shoulder blade, numbness, tingling going down their arm. The longer they sit at a computer and play with the mouse, the worse the pain gets. They try and move the mouse to the other side. They try and stretch their arm out, things like that. Thinking that will help. They start to get knots in the upper trap, in the levator. They go get a massage. It helps for about 2 hours and the pain comes back. That's because the pain is not coming from the muscle. The pain is coming from the nerves, possibly a disc problem. Your spine is supposed to have curves in it. Your cervical spine is supposed to have a backwards curve like this. The longer you sit at a computer, look down, look at your phone, this curve will start to straighten out. It could even reverse. What happens is the disc starts getting pushed backwards into the spinal cord. So if you have a bone here, disc here, bone here, when you bend forward, you pinch the front of the disc, which shoots the disc backwards into the spinal cord, cutting off the nerves going down the arm, cutting off the nerves going into the upper trap. The more you look down, the further the disc is going to get pushed backwards. If you look at my neck here, if I look like this, you can see the bend. It pinches the front of the disc, pushing the disc backwards into my spinal cord. So, to make it simple, what happens at some of the levels, not all, but it'll make it simple. The way that your head sits on top, if you bend your head and look down, this bends forward. If you look up to avoid your skull hitting this bone, this part bends forward. So the only way to get your cervical spine, your neck, to bend backwards is to keep your head level and slide it backwards. So you can imagine your head as a box. You don't want your head to rotate forward or back. You want it to slide backwards, slide backwards. So you don't want to be doing this or this. You want to keep your head straight and you want to slide straight back. That's called a chin tuck. You want to do a chin tuck. What I was saying before about if you bend forward, if you look at the disc here, right? So you have the nerves coming out here. You have your spinal cord. If you bend forward, you can see that disc start to squirt out and hit the back. So, bend forward, disc squirts out, cuts off the nerve, pain, numbness, tingling going down the arm. So you want to try and keep your head level, slide it back. A lot of times this will help. You may get some pain in the neck because we are actually pinching part of the disc, trying to pinch the disc, force it back into place. My recommendation is usually about 10 chin tucks about every 1 to 2 hours. You have to do this for a period of time, several days for it to work. If you took a knife and cut your arm and every day you were ripping the wound open, it would never heal. You stitch it back together and it's able to heal up, close, seal. Same idea with the neck, the cervical spine. Every time you bend forward, you're looking on your phone, you're sitting like this on your computer, you're ripping that wound back open. You're not giving it time to heal. By doing 10 chin tucks every 1 hour, every 2 hours, you are giving that time to heal. You're pinching it back together. Things that you want to avoid: looking down on your phone, your tablet, reading, laying in bed where you're laying on the pillow watching TV. You don't want to be laying like this in this forward position. That's pushing the disc back out. You're pinching the front, pushing the disc back out into the nerve. You want to fix this problem by doing this. Anytime that you start to feel pain go into your shoulder blade, down your arm, you want to immediately do 10 of the chin tucks to try and fix that problem. Usually I see that it takes about 2 weeks for this problem to heal.